The Medicare Trust Fund is within a decade of running out of money. And I don't want you to take my word for it. I want it to come straight from them. So let's take a look at what they say. The projections in this report show that change is needed to address Medicare's financial challenges. If elements of current law are not adhered to, even more substantial changes could be needed. The trustees recommend that Congress and the executive branch work closely together to quickly address those challenges. The estimated depletion date for the Hospital Insurance Trust Fund is 2033, 3 years earlier than projected last year, primarily due to the change in projected expenditures. See, I've got 2 decades in this business, largely centered around Medicare and Social Security. And what I know is that this trust fund report comes out every year. And every year, it's getting worse. And we're closer to the problem than ever. They say we're going to run out in the year 2033. And I thought it important to highlight some of the problems that I see coming down the road. I want to read to you this statistic. MedPAC, which advises Congress on Medicare issues, says MA plans, Medicare Advantage plans, are substantially overpaid compared to traditional Medicare. Congress's Medicare Payment Advisory Commission, MedPAC, estimates that MA, Medicare Advantage payments in 2024 were 22% above traditional Medicare, a difference that amounts to $83 billion in annual spending. Much of these overpayments benefit the MA plans rather than their enrollees. MA plans receive a fixed payment for each member, regardless of services delivered. Your MA plan gets paid the same regardless of the service that they deliver to you. This gives plans a financial incentive to restrict care once people are enrolled, sometimes resulting in service delays or denials. This is coming straight from MedPAC, not from me. Medicare Advantage plans can move around your benefits in order to make themselves more profitable. See, they get paid the same regardless of if they give you care rated an A or care rated an F. MA enrollees may also face inadequate provider networks, which limit access to timely needed care and imposes burdensome travel. Meanwhile, misleading marketing exaggerates MA plans' benefits and obscures their limitations, enticing some Medicare beneficiaries to enroll in disadvantageous Medicare Advantage plans. Now, that's straight from them. What does that mean? From somebody with 2 decades of experience in this industry, what I can tell you is this: Medicare Advantage programs have added ancillary benefits to what they're required to cover in order to make themselves more appealing to you. With an estimated depletion to the trust fund less than a decade away, Medicare Advantage programs spending 22% more per enrollee versus traditional Medicare expenditures is not a good equation. It's what I call the Medicare Advantage ticking time bomb. See, right now, Medicare Advantage programs are appealing. They come at either low cost or no cost. Having a 0 monthly premium for your Medicare Advantage program is very appealing. It's nice to get insurance that doesn't cost us anything monthly. But those benefits can change annually. The Medicare Advantage companies that administer those benefits, they can change your plans right under your feet. They can change your benefits, and the doctors that are in their networks can change overnight. And so as we progress towards that date of 2033, when Medicare says that they have a shortfall in their trust fund and they're no longer going to be able to pay all these benefits, where do you think that the cuts are going to come from? The traditional Medicare system or the Medicare Advantage system, where it's proven that it's 22% more expensive to have a beneficiary on than just traditional Medicare? Now, I don't want to go crazy and tell you that Medicare Advantage programs are the worst or that you're going to die if you're on one. That's not my intended message here. But my intended message is that if you're enrolled in a Medicare Advantage program today because it may save you a few dollars in premium, or because you're healthy and you don't really go to the doctor all that much, you're setting yourself up for failure future in retirement. See, let's fast forward 5, 8, 10 years down the road, and maybe you're 65 today and you've elected a Medicare Advantage program and you're healthy and you don't go to the doctor. You're going to be thrilled. You don't pay anything monthly. You don't have any expenditures because you don't go to the doctor. But guess what you've signed up for? You've signed up for a plan that can change the doctors that you can go to, that can tell you which procedures you can or cannot have done, the order in which you want to have those procedures done. It doesn't matter. You have to do it the way the insurance company says. Oh, and guess what? They can change how much you have to pay as copays, and they can change your benefits on you overnight. And most people don't take the time to review these plans annually and make sure that they're best suited for their needs. But even worse than that, if you're on a Medicare Advantage program and you're in there for years, and then you get sick and you say, you know what, this Medicare Advantage program isn't meeting my needs anymore. I want to go to a Medicare supplement. Guess what you can't do? You can't go to a Medicare supplement unless you answer their health questions and pass their underwriting. They can turn you away for pre-existing conditions if you've waited that long. But guess when they can't do that to you? When you turn 65, you get an initial enrollment period that guarantees you acceptance in the plan that you enroll in. And so this decision, the one to pick your Medicare plan, it may seem small. And when you ask your financial advisor, he may brush it off or give you an off-the-cuff remark that he gives to everybody. But this decision is going to have major impacts, especially when Medicare's trust fund runs out of money in 8 years. See, the cuts are going to come. And they're going to come from the places where the money is being spent. And I want to highlight for you how this money is being spent. I want to look at where these benefits are. What do we think is going to happen to them? And let's make some logical conclusions. So I'm including here benefits from a plan that's available in my area. And before you attack me or come for me in the comments, I'm not saying that people don't need these benefits. I'm saying that when people look at this financially, where do you think the cuts are going to come from? The traditional side where it costs X, or the Medicare Advantage side where it costs 22% more, according to MedPAC, who advises Congress on Medicare changes. They say it costs 22% more, not me. Let's take a look at these benefits. Over the next decade, the federal government expects to spend $9.2 trillion on Medicare Advantage payments. Of that, $1.3 trillion is for supplemental benefits and premium buy-downs. What are supplemental benefits and what are premium buy-downs? Supplemental benefits are anything in addition to what Medicare says those companies have to cover at a minimum. And so at a minimum, Medicare Advantage programs have to cover what Medicare covers. But they're allowed to add in supplemental benefits. And they're allowed to offer you money back for your Part B premiums. See, they get paid the same when you sign up, regardless of if you're sick or healthy or however much they're going to have to pay for your care. They get paid the same. And so they add in these benefits to make them sound more appealing, to entice people like you to sign up for them. But there's no discussion about what this means long term or the repercussions that you'll face 5 or 10 years down the road when this cut to Medicare happens. Averaged over 10 years, that's $130 billion annually for both over-the-counter allowances, which are part of supplemental benefits, and premium buy-downs. Seems like an easy place to cut to me. When we're looking at this objectively, if it's 22% more expensive, these are the areas that are going to get cut. But the benefits that are going to get cut are significant. So, available in my area, on a plan that exists here, you can get 48 round-trip transportations covered to and from your doctor's visits for zero copay. You can get $264 a month for food and over-the-counter and utilities credit. This is in addition to if you qualify for SNAP benefits or any additional nutrition programs. You can use that to shop for healthy foods or over-the-counter products like fruits and vegetables, meats, seafoods, dairy products, vitamins, supplements, pain relievers, cold remedies, first aid items. You get it. A minimum of $35 before applicable tax applies to online orders. Right? And you get $264 a month. Remind you, you don't pay anything to be on this plan. You can get fitness programs. You can access gyms and online workouts. You can get up to $2,200 a year for hearing aids. Reminder, Medicare doesn't cover this. This is an extra benefit that they throw in. $0 copay, up to $2,200 for hearing aids. $0 copay, up to $400 a year for vision and eyewear. $0 a year annual deductible for dental with a $3,500 maximum. $0 copay for preventative services and fillings, and $0 copay for comprehensive services. Again, listen, I'm not saying that people don't need these benefits. But when they look at the budget and they see that these plans cost 22% more, objectively, in a real world, where do you think that these cuts are going to come? And do you want to be trapped on a plan that can change under your feet and then you cannot go somewhere else? I think not. The Center on Budget and Policy Priorities says Medicare Advantage plans are substantially overpaid compared to traditional Medicare. Congress's Medicare Payment Advisory Commission, MedPAC, estimates that MA payments in 2024 were 22% above traditional Medicare, a difference that amounts in $83 billion in annual spending. Medicare trustees project that the Medicare Hospital Insurance Trust Fund will be insolvent in 2033 with a 75-year shortfall. Meanwhile, total gross Medicare spending will continue to grow. I think their definition of gross spending and mine of gross spending, makes me want to vomit, is very different. Look, there's 32.8 million enrollees in 2024 in Medicare Advantage plans. That's 50% of the Medicare population, projected to be 58% of the Medicare population by the time these cuts have to go into effect. 58% of all Medicare beneficiaries will be enrolled in a Medicare Advantage program. And if these benefits get cut to the point where they're no longer advantageous, or that it doesn't provide you the care that you want, you are going to be stuck in this plan and you will not be able to do anything about it. Medicare supplement companies are not in the business of bringing on people who are sick. They ask questions and they eliminate you based on your pre-existing conditions. And so if your plan is to just take a Medicare Advantage plan and ride it out until I get sick and switch to a Medicare supplement, boy, do I have bad news for you. Not only are these Medicare Advantage plans going to change, and they are, but you're going to be locked into them and not able to switch to a Medicare supplement plan that will allow you the freedom to go about getting your health care in the way that you want. As a retirement planner, I need to not only account for what your needs and your wants are today. Yeah, maybe you want a health care plan that's a little bit less expensive. But what does that look like 5 years from now, 10 years from now, 15 years from now, when you're into your retirement, those periods of time and your health is deteriorated because you're getting older? Where do you want to be? On a Medicare Advantage plan that can change the rules and change the game on you and that is going to get cut? Or do you want to be on a Medicare supplement program that is standardized and that is 22% cheaper to administer than a Medicare Advantage plan? I'll let you make the decision. Oh, God agrees. He's shining a light in on me. This is our opportunity to not only take people off of Medicare Advantage plans, but show them the light of Medicare supplement as this light is shining in my eyes through the window. Medicare supplements allow you the freedom to go to any doctor, any hospital that accepts Medicare anywhere in the country without a referral. Average premium on the plan that I advocate for is $55 a month here in Florida when you turn 65. So if your plan is to enroll in a Medicare Advantage and save a little bit of money and maybe down the road I'll look at that Medicare supplement thing, I'd encourage you to reconsider. These plans are going to implode on people. You see the television commercials, 0 monthly premium, dental, vision, all these benefits that exist to entice people to sign up. The Medicare Trust Fund report has something to say about those, and I want to share it with you. The projections in this report show that the change is needed to address Medicare's financial challenges. If elements of current law are not adhered to, even more substantial changes could be needed, as shown in the illustrative alternative scenario. The sooner solutions are enacted, the more flexible and gradual they can be. Introducing reforms early would give affected individuals and organizations, including healthcare providers, beneficiaries, and taxpayers, more time to adjust their expectations and behavior. The trustees recommend that Congress and the executive branch work closely together to quickly address these challenges. Breaking news: Congress isn't doing a thing about this. And I'd like to highlight that for you with a recent conversation I had with my congressman. Check it out here. There is on the books a planned cut to benefits coming in 2033, or at least that's what the Social Security Trust Fund reports. And as somebody who just kind of operates independently, I don't have a lot of insight into that. I've talked with people that I feel like are professionals in the industry, but that becomes a concern when people are at age 55 wondering if their benefits are going to be the same at age 65.
What is the planned cut that you're talking about?
So, according to the trust fund's report that comes out each year, Social Security is not going to be able to pay benefits starting in 2033 fully. So, they estimate only being able to pay 79% of what's supposed to be paid out. And that, obviously, at least in what I've gathered, there's only two fixes for that problem. Either you increase taxes or you decrease benefit. And Social Security right now says 79% is what they can pay.
So again, I'd reiterate, no planned cuts for anybody.
Yeah. Based off of my conversations, I have zero confidence that anything is being done at the legislative level to curb this, even though the warnings are in the report. And I've gone back through these reports that come out each and every year, and I have some questions. See, in these reports, there is a spot for a public trustee to sign off and weigh in. And for the last decade, that spot has been vacant. But in 2015, there was two gentlemen that filled those public trustee roles. And a few years after they were asked to vacate their roles, they put out their own report. And I think that it's a pretty scathing one, but one that, again, has gone unheard and ignored. And I'd like to share that with you now. It's a 3-page report, and I'll share the link. But the last sentence is the part that I find to be the most impactful. See, these public trustees, they know what the problem is, but they're not in a position to fix it. But they can highlight a strong area for us to pay attention to. What I want you to see is this. Americans can no longer afford to indulge the myth that Social Security and Medicare are best safeguarded by leaving their benefit and tax schedules alone. That comes from Charles Blauhaus and Robert Reischauer, who were the public trustees before they were asked to vacate, and that public trustee spot has been left vacant on every subsequent report that has come out. But they're saying that we can no longer afford to sit back and watch. And they were saying this in 2018. And as you saw, nothing has changed. I'm sounding the alarm bells. The Medicare Advantage system will implode on itself, and there will not be someone there to pick up the pieces for you and plug you into a Medicare supplement program that is going to help you. Because you're going to be older, you're going to be sicker, and you will not be able to pass their underwriting questions. As somebody who's dedicated the last 2 decades of my life to this industry, I'm begging you not to fall into the trap. We've highlighted for you in a different video a Medicare supplement plan that allows you to go to any doctor or any hospital in this country that accepts Medicare without a referral or without authorization from the insurance company. That plan costs you $55 a month. If that's unaffordable and you need a Medicare Advantage program, I get it. I know there are people out there in that circumstance. But there's a tremendous set of people that I talk to that say, yeah, $60 a month, I could do so much with that. I'm just going to take this Advantage plan because it's easy, everybody else is doing it, and the commercials make it sound great. The 2 individuals that were not government employees, that were in charge of putting this report out, say, in their words, Americans can no longer afford to indulge in this myth. This is going to happen. It's going to be violent. The longer we wait, the worse it's going to get. And the answer from Congress is, there's no planned cuts. What are you talking about? They don't want to take on this issue because there isn't a winner. You either raise taxes or you reduce benefits, and nobody likes those options. That is not my opinion. That is what it says in the report. And as somebody with experience in this field, I know what's coming. The Medicare Advantage programs are going to see significant decreases to benefits. And you're going to be stuck there, and I'm begging you, please reach out and talk to me about what this means. What are your other options? And what exactly are you signing up for when you sign up for that Medicare Advantage program? And is the person who's signing you up got their eye 5, 10, or 15 years down the road? Or do they just have their eyes on that big commission check that comes from Medicare Advantage when they sign you up at 65? I have a pretty good insight into this business, and I know the people that are enrolling you in these plans. Their focus is on their pocket and their paycheck, and they do not care what happens 15 years down the road in most circumstances, or they're willfully ignorant to it. But the Medicare system itself is telling us that this is happening. So what the heck should people do? That's a great question. You should act proactively. You should make changes to your plan now. Don't wait for Congress to make cuts, because the longer they wait, the more violent it's going to be. And you can see, based on my interaction, they're not planning on doing anything today. They pretend like this isn't even happening. 8 years isn't that long. It would take us 10 or 15 minutes to do an exploration of your benefits and your plan. Reach out, hop on our calendar. It doesn't cost you anything. And we'll see if there's benefit changes that we can make, or plans that exist for you that make more sense, that aren't going to put you at risk of your health care becoming a problem for you later down the road. DKAC is here to help you in retirement, not just today, not just tomorrow, but 5, 10, 15 years down the road. We want to make sure that we make the best selections for you for your whole retirement.